Hi guys, and welcome back to my channel. Thank you guys so much for tuning in to yet another video. So welcome back to episode 2 of the Specialist Midwife series, and in today's video we're going to be talking about the diabetic specialist midwife. So one of you left me a comment asking me to go into more detail about what it means to be a diabetic midwife, so I've got all the details for you guys in today's video. I'll be diving into the role of the diabetic midwife, including the education or the training that you need in order to become a diabetic midwife, what it means to become a diabetic midwife, and also the salary, and if there's other job opportunities available, I'll be sharing with you guys in today's video. And if you haven't seen my previous episode where I dived into the safeguarding midwife, please make sure you go and check it out. I have linked it in the description box below, so make sure you go and check that out if you're interested in all things safeguarding midwives. But let's get started with today's video. Let's talk about what it means to be a diabetic midwife here in the UK. So what is diabetes? Let's start with a brief description of what diabetes is. Let's talk about the different types of diabetes and how it can affect pregnant women. So diabetes is a disease where the body is unable to produce or respond to the hormone insulin, which can result in high levels of glucose, which is sugar in the blood. There are 3 main types of diabetes. Type 1, a lifelong condition where the body produces little or no insulin. Type 2, where the body doesn't use or produce insulin properly. Gestational diabetes is high blood sugar that develops during pregnancy and usually disappears after giving birth. Gestational diabetes can happen at any stage of pregnancy, but is more common in the 2nd and 3rd trimester. It happens when the body cannot produce enough insulin, a hormone that helps control blood sugar levels. So that's the definition and the 3 main types of diabetes, which is type 1, type 2, and gestational diabetes. So on the screen I'll put some information for you guys if you guys want to know more about gestational diabetes, of who is more at risk of developing gestational diabetes. But any woman can develop gestational diabetes, but these women are more at risk of developing gestational diabetes during pregnancy. And here are some common symptoms of gestational diabetes that can affect pregnant women. So most women with gestational diabetes otherwise have normal, healthy pregnancies and babies. So how does gestational diabetes affect pregnancy? So for most women with gestational diabetes have otherwise normal pregnancies with healthy babies. However, gestational diabetes can cause problems such as your baby growing larger than usual. This may lead to difficulties during the delivery and increases the likelihood of needing induction of labor or a cesarean section. Polyhydramnios, too much amniotic fluid, which is the fluid surrounding baby and in the womb, which can cause premature labor or problems at delivery. Premature birth, giving birth before the 37th week of pregnancy. Preeclampsia, a condition that causes high blood pressure during pregnancy and can lead to pregnancy complication if not treated. Your baby developing low blood sugar or yellowing of the skin and eyes, which is known as jaundice, after he or she is born, which may require treatment in hospital. The loss of your baby, known as stillbirth, which is very, very rare. And having gestational diabetes also means that you are at an increased risk of developing type 2 diabetes in the future. So let's talk about what the diabetic specialist midwife does or do when caring for women with diabetes, whether it's type 1, type 2, or gestational diabetes. So the diabetic midwife will be the point of contact for diabetic patients and will be responsible for the support and advice on both diabetes control and midwifery care throughout pregnancy and the postnatal period, liaising closely with the diabetic specialist nurses, dietitians, consultants specializing in antenatal care. They develop and adhere to care plans for women with diabetes, provide guidance and support to women and their families when care becomes more complex due to diabetes. Also, the diabetic midwife will be expected to undertake clinical audit and provide educational support for healthcare professionals and students. So So the diabetic midwife will undertake assessments, provide support, education and advice for patients with pre-existing or gestational diabetes, review and discuss results from the blood glucose monitoring database and prioritize care accordingly. So diabetes specialist midwives are there to empower pregnant women with diabetes to make informed decisions regarding their condition and guide them towards a normal lifestyle, detecting and preventing complications for patients and their babies using both verbal and written patient information. So diabetic midwives still need to act in a safe and professional manner at all times in accordance to the NMC Code of Conduct. So in summary, the main duties and the role of the diabetic midwife is to provide optimal care for women with pre-existing diabetes, assess and establish individual management plans for women with gestational diabetes on treatment and liaise with community midwifery teams, provide clear routes of referral to clinic and care pathways, education of women including diet and healthy eating, lifestyle modification, insulin injection and dosing, further diabetes risk and preconception counseling. So let me talk you through how a diabetic midwife will come into play. If I am someone that is booking a woman in the booking appointment, she has found out that she's pregnant and she's coming to my hospital and wanting to book at my hospital. So while I'm sitting down with this woman and she tells me about her medical history and she discloses that she has, for example, diabetes in her family, it runs in her family, she herself does not have diabetes but it runs in her family, and say for example she has a high BMI and she has other risk factors that may be a potential risk of her developing gestational diabetes, I will then refer her to the diabetic midwife for further testing, and I will also refer her to the diabetic clinics to be tested for diabetes during her pregnancy. So this pregnant lady will go for her test to be tested whether she has gestational diabetes during her pregnancy, and if it comes back that she does have gestational diabetes, then she will be cared for by the diabetic specialist midwife. So the diabetic specialist midwife will then do all her antenatal appointments right up until she gives birth, and while she's giving birth she will give advice and make a care plan for the labor ward midwives who will be caring for her on labor ward, so that everything is implemented so that she is cared for correctly in line with her gestational diabetes, and she will also make a care plan for what needs to be done in the postnatal period. So that diabetic midwife may not follow that specific woman in the labor room and postnatally, but she will make a care plan, a clear care plan for other healthcare workers to go by in terms of what they need to do for her care and what they need to adjust and what they need to make sure that is in place for her to have a smooth care while she is pregnant, having her baby, and in the postnatal period. So that's typically what a diabetic specialist midwife will do. And in the postnatal period, the diabetic midwife will also follow up with these women, make sure that everything went smoothly, and also talk to her about other future pregnancies and how she can lower the risk of her developing type 2 diabetes in the future, and how she can maintain a healthy lifestyle so that there's no implication for herself and her babies in other pregnancies that she may decide to have. So that's basically what a diabetic midwife will do. Other things that a diabetic midwife will do is also train other midwives and other healthcare professionals working within the multidisciplinary team. And another thing that a diabetic midwife will do is work with building policies and guidelines that can be implemented in the hospitals within maternity for women to have a smooth transition or a smooth care within maternity. So they are the people that review these care plans, review these policies, and make sure that the care is being improved over time. If things are missing, they are updating the policies. If things need changing, they are the ones implementing and updating policies and reviewing them, that everything is within the policy so that we know where to turn to if we need answers for things or if we need certain guidelines. If I'm inducing a woman with GDM, then I will go to the GDM pathway or guideline, and it can tell me what I need to do specifically for this lady with gestational diabetes. So they'll be part of the people that are implementing these policies and guidelines and also reviewing them, making sure that they are up to scratch and at a high standard for us to then care out and care for these women. Okay, so let's move on to the qualification and training that you need in order to become a diabetes specialist midwife here in the UK. So some hospitals may require different things depending on the post that you are applying to, the area, the hospital. Some things are essential, some things are desirable, so it all depends on where you are applying. So So you need to be a registered midwife with a band 6 post of registration with clinical experience in order to become a diabetes specialist midwife. You also need to be a sign-off mentor or practice assessor. That is also something that they are looking for in order for you to become a diabetes specialist midwife. So some hospitals may need significant experience in the role of the diabetes or maternal medicine within a band 6 role. Training or courses surrounding diabetes, attending a clinical leadership program, or having a leadership course or degree or experience. And I will also list other things that they may be looking for if you are looking to apply to become a diabetes specialist midwife. Okay, so let's dive into the salary of the diabetes specialist midwife. So there's a lot of salaries out there right now when it comes to the banding, the role itself, the hospital, the area. The salary varies depending on those type of things. I'll just go through the current job adverts and what they are offering for a diabetic specialist midwife, and I'll also put a range on the screen so you guys can have an idea of the salary of the specialist midwife. So the first role I saw on the internet is at St. George's University Hospital NHS Trust, and they are recruiting a band 7 specialist diabetes midwife, and the starting salary is between 54 to 60k a year, and that is at a band 7. And another post that I saw at the Queen Charlotte Hospital for a diabetic team midwife at a band 7, they are offering 54 to 60k a year at a band 7 as well. And another job that I saw at the Medway Hospital, they are also offering a diabetic specialist midwife at a band 7 at 46 to 52k a year at a band 7. So the range for diabetic specialist midwife here in the UK at a band 7 ranges between 46 to 42k a year here in the UK. That is roughly how much you'll be getting as a diabetic specialist midwife here in the UK, which is not bad. It's a good job if you're not really into working on the ward, doing anything clinical. So that is the average salary here in the UK for a band 7 diabetic specialist midwife. So that is it for episode 2, which is diabetes specialist midwife. I hope you guys have enjoyed it and have gotten a lot of information surrounding what it means to be a diabetes specialist midwife. If you are pregnant and would like more information surrounding diabetes, I have added some useful links in my description box below, giving you guys more information surrounding gestational diabetes, what to look out for, signs and symptoms and things like that. But that is it for today's video. I hope you guys have enjoyed it. Whatever specialist you guys would like to hear in the next episode, please do leave a comment down below and I will record the next episode surrounding the next specialist midwife. But until then guys, I will see you very, very soon in my next video. But don't forget to hit the subscribe button to join my YouTube family. Like this video if you guys have enjoyed it, comment and share. But until next time.